Sinus surgery. Introduction.
Please point to the sinus.
Choose one of the following options.
Correct. There are 4 pairs of sinuses. This sinus is called the maxillary sinus.
Mucosa is the lining of the nose and sinuses. It is made of cells that have special cilia to trap and expel dirt. Select true or false.
Correct.
Inflamed sinuses always result in facial pain, headache, fever, voice change, and tender cheeks. Select true or false.
Correct. Not all people show all the symptoms of sinusitis. Allergies could cause sinusitis.
Select true or false.
Correct.
When sinus infections keep coming back after medical treatment, this may indicate that there is an obstruction to the flow of mucus. Select true or false.
Correct. Endoscopic sinus surgery uses smaller incisions, which results in faster recovery.
Select true or false.
Correct.
Infection and anesthesia complications are common with sinus surgery. Select true or false. Correct. Anesthesia complications or infection are rare, but they could still happen.
Meningitis or infection around the brain is common after sinus surgery.
Select true or false.
Correct. Meningitis is extremely rare after sinus surgery. It is impossible for the sinus openings to become blocked again after surgery.
Select true or false.
Correct. Sinus surgery is very successful. However, in rare cases, it is possible for the blockage to happen again. It is normal to have bleeding after sinus surgery.
Select true or false.
Correct. It is normal to have some bleeding and drainage after sinus surgery. If the bleeding becomes severe, you should call your doctor. Signs of infection after surgery include greenish drainage, thick drainage, or foul smell.
Select true or false.
Correct. Call your doctor if the drainage becomes thick, greenish, or foul smelling.
Thank you for using Explain.